Thanks for joining us for today's Christie Clinic Medical Minute. I'm Hannah Strong, joined today by Dr. Kibler with the Department of Foot and Ankle Surgery, and he's here today to talk to us about bunions. First, can you just tell us what is a bunion?
A bunion's a deformity of the foot where the first metatarsal kicks out, the big toe kicks over, and you see the head of that bone, so you see the bump on the side of the foot.
I imagine you hear a lot of theories about how these develop. Can you give us kind of fact versus fiction?
Bunions are really a genetic deformity. Deformity is maybe a little harsh, but it's a condition where the bones actually move and you see the bump associated with that, but it's not caused by shoes or other factors. Usually if you look at mom and dad or grandma and grandpa and somebody has a bunion, you might get a bunion.
Okay, good to know. In terms of preventing these, you mentioned it's not necessarily from shoes, but are there things that people can do to make sure that they don't have one or it doesn't cause them quite as much pain?
Certainly shoe changes and other modifications can be made because they can oftentimes rub on the bunion. One of two things happens with bunions. They either hurt because of the bump itself or they hurt because the joint's malaligned and it's starting to get arthritic changes. So oftentimes shoes and other padding and offloading modifications can help.
And for folks who think that they might have a bunion or it's developing, what should they do?
They should come see one of us. We can talk about some of these things. Usually we use radiographic findings to determine the severity of a bunion, options that they have, whether we can proceed conservatively or we need to proceed surgically. Sometimes when you have a bunion, if it doesn't hurt, you don't need to do anything.
Well, that's good to know. Thank you for teaching us something about bunions today. This has been today's Christie Clinic Medical Minute.